Hello, everybody. Brock Weld here to talk to you about functional neurological disorder. And this is another therapy video. This is to talk about therapies that have worked for me, and maybe they'll work for you. But going through functional neurological disorder is kind of tough. You actually have to find out kind of what works for you. And I'm going to talk about two of those tonight. One of them is animal therapy. In 2018, it was about October 2018, I went to the hospital in a big rush. It was the first time I had a very bad, like debilitating type episode. I was on a conference call. I owned a company, so I was in charge of the calls on call for a while, and all of a sudden I could feel the right side of my face tighten up, and all of a sudden I started like kind of fish hooking my mouth, trying to just yank it open because I was having a hard time speaking. And then there was a pause in the conversation. All of a sudden it was my turn to speak, and it just came out as gibberish. It came out as alien talk. Everybody in the room was looking at me, my employees, and I did not understand what they were looking at, because from my point of view, since I had the words organized in my brain, when I went to go say them, it just came out all wrong. But I didn't hear it that way. I actually heard what I thought I said. And then I tried to say it again, and it was even more alien talk. And that's when everything became an emergency. Everybody thought I was having a stroke, so they called 911. I went to the ER. It was bad. It was not good. They had every kind of doctor in there looking over me, and it was it was terrifying. So they admitted me to the hospital, and then I was there for a couple days. About the second day, somebody came by, like one of the I don't know what we call them, but they're like a volunteer, and they came by with a therapy dog. So this dog has been trained. It was a golden retriever, and they're like, they just walk into my room and they say, "Hey, do you need any company? Would you like to pet the dog?" And I noticed, I touched the dog, and I like dogs. I've always had dogs, but I reached down, but then I put my other hand on the dog, and it was huge for me. It was a really cool moment, and I would later go on to understand about the neurochemistry and how things like that, especially when you touch an animal or a loved one, how it releases oxytocin. And that's part of my problem, is the way whatever damage I have through my TBI or anything else, and the head injuries, I do not produce oxytocin in the same way. I either produce not enough of it, or I produce way too much of it. And oxytocin is kind of the hormone in charge of, it gives you that affectionate release when like when you touch a dog, when you touch a puppy or something like that. So as soon as I got out of the hospital, I decided that was probably good for me. My doctor said, yeah, if it helped you in any way, I'm all for it. We bought the dog, and we knew that we were going to I have 3 kids, and we knew it was going to be somewhat of a family pet. Basically, the idea is for a service animal of any type, really, but in my case, the idea was to buy the dog and put him through a series of training in order to train him up so that, 1, he could carry my medication around with me, 2, it would help me get through seizure-like episodes, and it would also allow the dog, properly trained, to block. That's one of the things that when you're going through an episode, you want people to kind of stay away from you. I wouldn't say it's like a guard dog. It's more like if you're having an episode, their job would be, on a proper command, would be to kind of like bark at people and keep them away so they don't make your condition worse. I got to be honest, we never got to that level of training. We got the dog a couple months later. He's about 2 years old right now. But I remember this day going to pick him up at the airport, and it was huge. Believe it or not, I am devastatingly sick in this picture. I was not having a great day, but puppy jumps out at you, it's kind of hard not to be happy. So it did have a lot of benefit for me. His name's Cooper. I know I'm with me right now, but that's a different story. And then obviously he comes as a family pet, and those are my girls. And so overall, animal therapy has been very good for me. I do enjoy it. It was tough being sick and having a puppy, but it is what it is. But if I had to do it again, I would definitely do it again. I think it's a critical thing. But I did also notice while I've been away from, I don't have my dog now, but I did notice that in addition to like the oxytocin release and how you, get that kind of rush of affection from an animal, I did notice as I've been traveling, I bought a really big fuzzy blanket that has like a Sherpa lining to it. And I noticed that when I was getting symptomatic, if I would touch that and kind of run my fingers along the Sherpa lining of this blanket, that tactile response actually kind of balanced out. It has something to do with sensory perception and how if it's coming from both sides equally. So I started experimenting on other stuff, whether it was sandpaper, anything to basically get both sides of my body kind of literally on the same page. So that might be something that helps you get through a tough episode, that might get you through seizure, just having something. But I think that you'd have to find out what that is on your own. Wouldn't let somebody else decide, here, hold on to this, because it definitely can't be too hot or too cold. I have really hard times controlling. Temperature variations are horrible when you're going through a functional neurological non-epileptic seizure-like episode. But animal therapy or some kind of tactile response, even a fidget device might help you. Something to keep, I would recommend something that keeps both your hands doing. When I'm alone, one of the things I do to see if I'm starting to become symptomatic, 1, 2, 3, 4, 4, 3, 2, 1, and then on this hand will happen as I go like 1, and I can't get to 2 or 3, and that's when I know. There's also another thing about depth perception that affects functional neurological disorder, in that that's one of the reasons I have zero problem driving. It has something to do with since my eyes are basically constantly evaluating different distances and stuff, like my brain's engaged. Things like that. I've had a very serious emergency episodes where I wasn't the victim. Months ago, me and my son saw a lady hit some water barrels, and I ran back. And even though I was symptomatic, I popped out of it and I ran back. I pulled this lady out of her car, and I was totally fine. But when I got home, I was toast when I got home. So animal therapy, some kind of any kind of therapy that basically engages you in a way that does not, wreck your brain chemistry. You should really look at something that's bilateral, basically same sensation on both sides. I think it'll help. The other thing is, after recently I was in the hospital and I saw a new neurologist, and one of the breakthrough things, I had a few things break loose in my health. That's why I started these videos, to start sharing stuff, again, a lot of clarity on what was working, what was not working. And one of the things I changed after I had a massive seizure-like episode right after I got done with my shoulder replacement surgery. I was in bad shape. I actually had no idea who I was, where I was for like an hour and a half, 2 hours. It was. I didn't even understand that Trump was president. It was surreal. So the neurologist came in a couple days later, and he says, "I've read your whole case file. I know you tried a lot of medications. But I want you to try this medication I've had a lot of success with, and it's called Keppra." Okay, so I'm going to try to get this. I blacked out some of my information. And so it has this really weird name that I'm not going to try to pronounce, but that is the drug name, and but it's also known as Keppra, Keppra. So the way it was explained to me, what Keppra does is, when there is like a frequency imbalance in your brain, the standard of care in the past has always been to basically give the patient some kind of stimulant or anticonvulsant or anti-seizure medication. But what that did is, like, let's say you're supposed to be operating at 9 hertz through your brain chemistry, and it's like one side over on my right side is operating at 4 hertz, right? Creates this imbalance. And my right side does not ever catch up and does not properly communicate with the left side. That's why I can understand, I'm very aware of what's going on. I can hear and remember things going on. It's just my right side feels like it weighs 1,000 pounds. So the standard of care in the past, and like I said, functional neurological disorder is a diagnosis of omission. Basically, they have to find out everything is missing. So they might give you medication that makes it worse. In my case, they gave me sumatriptan and Imitrex, massive amounts of Depakote. And my doctor also told me that they would also give people Adderall, to try to, stimulate the brain. But what happens in my condition, at least, and I've heard this is more common, some of those medications, what they do is they dump all that stimulus into the side that's already elevated, and it actually makes it worse. And that creates this weird cycle where people they're sick, they go and see a doctor, is like, I think you have Parkinson's or MS or epilepsy or whatever, right? You're presenting with very specific symptoms, and that might be their specialty. And so they give you that medication, you kind of get sicker, and then they tell you, well, you got to wait for your your blood to get fully saturated with the drug in there, and they want you to, so every time you go through one of these things, and that's what a lot of people don't appreciate that do not have a disorder like this, is you go see a doctor, you just signed up for at least 3 or 4 months of just seeing if that worked. And then doctors don't like to be told it's not working, and they kind of get, want to say, well, move your ass on down the road and stuff, and then all of a sudden you're alone again trying to figure out, well, do I go see another neurologist? Do I go see a different specialist? It's really tough. But like I said in my previous videos, when I got my shoulder replaced, and it was about 10 days later, I felt this huge weight come off me, and I did not talk like this or engage like this at all a few months ago. It was very hard for me to speak. It was like I was living in one of those seizure-like episodes all the time. And so it was really tough, but I had this kind of breakthrough moment between the shoulder surgery and the Keppra. And I have had dramatically fewer seizures. I've really turned a corner. I know I've shown some of these seizures in the last few weeks, but that was because I wanted to show the ugly side. I want people to really know what this disorder is like. So when you hear somebody says, yeah, I have functional neurological disorder or conversion disorder or something that, don't write them off. They are probably going through a lot, way more than it might seem. And I have talked to several people now that have functional neurological disorder, and I'm sorry, people, but all of our stories are extraordinarily consistent. It is a large data set of people that says, nobody believed me. They thought I was faking, psychosomatic, you're crazy, just all kinds of things, because they just don't understand nobody wants to take the time it doesn't have a catchy name like MS or Parkinson's, functional neurological disorder. They're like, maybe it's your fault. It's not. So the Keppra, what it does is, instead of trying to raise up the 4 hertz side, it actually brings down the other side, right? So it's at a lower level, but it builds up your neural plasticity. And those drugs like that, it takes about 3 or 4 months. I happen to be like right about 3 months. So my seizures are getting, seizure-like episodes are getting much more infrequent, much less severe. And, but it's not a cure. I'm actually going in for a stem cell treatment. I'm going to do a whole series of videos about that next month, I think next month in Arizona. But that's a whole different therapy. But tonight I want to talk about animal therapy and Keppra. They definitely had a very positive impact on my health. So that's it for now. So don't give up. Don't give in. You are never out of the fight. I know it's tough, but it does get better. So until next time, Merry Christmas, everybody. Happy New Year.